Okay, we are live. Good evening, everyone. Today's session is going to be really helpful and is led by Dr. Soumya from Apollo Cradle and Children's Hospital. She is going to talk about UTI in pregnancy and its prevention. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you. I am Dr. Soumya Raghavan, obstetrician and gynecologist from Apollo Cradle, Karapakam. Today's topic is UTI in pregnancy and whether we can do anything to prevent it. UTI is the urinary tract infection, which is one of the common infections which occur in pregnancy, second only to respiratory infections, like the common flu and all that. So the second most, I would say, is the UTI. So why are we so bothered about UTI? Urinary tract infection can lead to a lot of complications in pregnancy, and that is why we are bothered about treating the urinary tract infection. So let us first see how important it is, meaning what is the prevalence of UTI. About 8% of the pregnant women face urinary tract infection at some point of time. So, why is it so common? Basically, women are prone to UTI, that we all know, basically because of the difference, anatomical difference between the female and the male urethra. So, females as such are more prone to urinary tract infection, and pregnancy poses even more of a problem. Why is it so? So, let us see what are the changes which happen in pregnancy to the urinary tract. Basically, in pregnancy, there is increased blood flow, increased blood volume, and increased cardiac output, and thereby there is an increased flow to the kidneys, blood flow to the kidneys, and so the urine production is more, the bladder volume is more. So what happens is you will also have increased frequency of urination because of more urine being produced, and also a little bit of urgency, which is common symptom in pregnancy. So this should not be mistaken for UTI. Now let us see why, what are the changes which occur in the urinary tract in pregnancy. See, the urinary tract becomes a little more relaxed. That is the tone of the bladder, the tone of the ureter. Ureter is the tube which connects the kidney with the bladder. So the tone of the ureters also is reduced. The tone of the bladder, urinary bladder also, the tone is reduced. The muscle tone is reduced. Also, the bladder volume increases. Then the pelvic floor muscles which support the bladder, all of them have a little lax tone. Why is the tone of all these organs less? That is because of the pregnancy hormone progesterone, which has a relaxation effect on all of these, in addition to causing relaxation effect on the uterus. So, what happens is the progesterone causes the ureter to become a little more, what do I say, tortuous, and it also causes a little dilatation of the ureter. Similarly, the bladder tone, as I said, becomes a little lax. Also, the pregnant uterus will compress on the ureters as well as the bladder. Thereby, you will have a little laxity and a little relaxed tone of the bladder and the ureter. The other thing is the pelvic floor muscles, as I said, become relaxed because of the progesterone effect, and as a result, the bladder neck gets stretched, and the bladder also has a little lower, the level. So because of all these changes, the sensation to urinate also, because the bladder can become really full because before you feel you have to urinate. Of course, I said increased sensitivity will be there in early pregnancy. That is because the uterus can exert pressure on the bladder, and so there will be an increased sensitivity in the early months of pregnancy. That is the first trimester. But later on, the muscle tone becomes relaxed, and because of that, you will have a yeah because of that you will have less sensitivity, less sensation until the bladder becomes really full, And what happens is you need to rush to the bathroom sometimes, especially when you're near term or something like that. So that is in the third trimester, because it is physically difficult for you to walk quickly to the bathroom, and also the the lethargy which comes with advanced pregnancy, where you feel like you cannot go to the bathroom very often, all those things. So because of these changes, there is an increased incidence or tendency for urinary tract infection. So why is it so? As I said, the bladder volume increases, the tone of the bladder decreases. You also have certain things like glucose and amino acids which are excreted in urine, which acts as a good culture media for the bacteria. Similarly, the tone of um, the lining, the urothelial lining is also, very, the immunity of the mother is altered. So the urothelial epithelium is more, what do I say, it gets infected easily. Similarly, after sexual intercourse, there's a little, even a slight damage to the urothelial epithelium, that is the lining, the epithelium which lines the bladder or the urethra, gets easily affected, and you can have an increased infection rate in pregnancy. So these are the reasons why urinary tract infection is common in pregnancy. Now let us see what is the incidence. About, as I said, 8% of women face urinary tract infection at some point during their pregnancy. So why are we really bothered about urinary tract infection? Urinary tract infection we can split into three categories. One is asymptomatic bacteriuria. The second is cystitis, which is the lower urinary tract infection, and pyelonephritis, which is the upper urinary tract infection. So, asymptomatic bacteria. First category is asymptomatic bacteriuria. Asymptomatic bacteriuria is like, the patients will not have, the pregnant women will not feel any symptoms, but when we are doing a routine urine analysis, we will see that there is increased pus cells and all that. So why are we bothered about asymptomatic bacteriuria, or do we really need to treat these asymptomatic bacteriuria? Why are we bothered is because the asymptomatic bacteriuria subsequently can develop sometimes into cystitis, which is infection of the bladder, or it can go to pyelonephritis, which is infection of the kidney. So, for this reason, we need to treat the asymptomatic bacteriuria. Again, when do we treat the asymptomatic bacteriuria? That is, you have no symptoms, only the routine lab test shows that you have infection. So, when do we treat it? Only when the colony count is significantly high. Say it is more than a lakh, then we need to treat the asymptomatic, because the patient, they have no symptoms, only the culture will show an elevated organism count, so which is like more than a lakh, then you need to treat. And otherwise, they will be symptom free. Do we need to frequently check for asymptomatic bacteriuria? Means it is not that every time you need to check for asymptomatic bacteriuria. Basically, very early in pregnancy, say in the late first trimester or the early second trimester, it is better to do one urine culture, which will tell us if there is any asymptomatic bacteriuria. If there is asymptomatic bacteria in the urine, then probably we'll have to treat it immediately, so that it doesn't proceed to cystitis, that is infection of the bladder or the kidney. The second category is acute cystitis. Cystitis is infection of the bladder. Infection of the bladder, generally they have symptoms. Either you could have painful urination, frequent urination. Again, as I said, frequent urination can occur normally in pregnancy also, but this would be different. You've been all fine in the first trimester, and suddenly you develop symptoms of frequency. You have urgency to pass urine. Before you go reach the bathroom, you might pass urine. That is one thing. And then painful urination, burning urination, and even uh, blood in the urine. All these will tell us that there is infection of the bladder. So, infection of the bladder. How do we treat the infection of the bladder? So what we infection of the bladder basically we can treat as an outpatient in the OP also. But first thing is if the symptoms are severe, we start off with an antibiotic, and then once the culture report, usually the culture report takes about 3 days to come, and after that probably we can start on the sensitive antibiotic. Till that time we can start off on an empirical antibiotic, which would be mostly sensitive to the organism. And supposing it is not sensitive, once they come back with the culture, then we can go on for the definitive antibiotic treatment. And usually the course of the antibiotic is for about 5 to 7 days. So, do we need to repeat the urine culture after this? It is not that every day we need to repeat the urine culture. So, once we treat it, I think we can just leave it like that. We need not repeat. Probably we can do a urine routine, which will give us an insight into whether, again, there is a urinary infection developing. That is urine routine, probably in each trimester, or probably every month also you can do a urine routine, but cultures we need not repeat again. Third, coming to the infection of the kidney, which is otherwise called the pyelonephritis, what symptoms do we normally see is they come with fever, they have nausea, vomiting, they have pain, basically in the renal, where the kidneys are placed, or in the costovertebral angle, we say, so in the back basically. So they might have pain there and fever with chills. All these are the usual symptoms of kidney infection. Kidney infection is something which has to be treated only in the hospital setup. We'll have to start IV fluids because most of the time they might be dehydrated. They might require more fluids in the body so that the organism gets flushed out. So for that, we need to give IV fluids. We need to start off on IV antibiotics. Here, we cannot give just oral antibiotics. We need to admit in the hospital, give IV antibiotics, treat. Once the symptoms are better, then probably we can shift over to oral antibiotic. But the entire course of antibiotics, that is, I'm talking about a sensitive antibiotic. Initially, we can start off with something empirical, and once the culture comes, we have to change to the sensitive antibiotic and continue the course for at least 14 days, because there is a chance of recurrence if we improperly treat the pyelonephritis. So we have, once the symptoms are better, then probably there is a good improvement clinically, then we can shift over to oral antibiotics, but that should be continued for about 14 days. So sometimes we have something called a recurrent UTI. Recurrent UTI again causes damage to the kidney, and pyelonephritis, basically why are we so worried? It is because we have complications both for the mother and for the baby. So for the mother, if you see, it can spread to the uterus, causing endometritis. It can cause choreo, that is, it can infect the baby's membranes, with the membranes which are surrounding the baby. It can cause that, and also it can lead to other infections in the mother, like it can spread to the bloodstream, causing full sepsis. And because of that, all organs can be affected, like the kidneys, like the kidneys as well, I mean the lungs. And it can cause clotting defects also. We call it disseminated intravascular coagulation. It can cause respiratory symptoms, all these things. So it can affect all the organs systems in the mother. For the baby, it can lead to early delivery, preterm labor. It can cause growth restriction in the baby because it can reduce the growth potential of the baby. And it can sometimes lead to increased mortality. That is, even if the baby is born preterm, sometimes it can affect the baby's, it can cause serious problems in the baby also. It can cause sepsis in the baby, all these things. So it can cause low birth weight babies. So all, it can affect both the mother and the baby. That is the reason why we should properly treat the pyelonephritis. Apart from that, I think recurrent UTI. So why, what precautions can we take? One thing is, probably we should make sure that how do we prevent all these things. We can probably drink a lot of water frequently, try to empty the bladder at least once in 2.5 to 3 hours, and also do the routine urine examination probably every month. That would help us, and an initial urine culture, which will also tell us if there is any chance of developing a serious upper urinary tract infection. So this is how we'll have to manage the urinary tract infection in pregnancy. But if properly, if we are like screening properly, I don't think we would go to the stage of kidney infection. And basically, the cystitis, which is, I said, the bladder infection or the kidney infection, is not that common. It is only about 1 to 2%, whereas the asymptomatic bacteriuria is about 2 to 10%. So we should make sure that this asymptomatic bacteriuria doesn't proceed to the bladder or the kidney infection. So I think with that, I've just outlined about the urinary tract infection. And if there are any questions, I would be more than happy to take them. Shivani, are you there? All right. If there are no questions, then I think I can end this session. Thank you, Shivani, for having me here.